great to have you join us on Health Matters, coming to you live on Channels Television. A warm welcome to the program. I am Yomi Otaigbe. On Tuesday, April 21, 2026, the Cross River State Government and the Nigeria Center for Disease Control and Prevention, NCDC, confirmed a case of COVID-19 in the state. The Cross River State Ministry of Health began profiling and tracing individuals in the state who've been in contact with a Chinese national admitted after testing positive for the virus. The Commissioner for Health, Dr. Henry Ayuk, said Cross River is recording its first significant case since 2022, promising to curb the spread of the disease. According to Dr. Ayuk, the patient who arrived in the country on March 17, 2026, is believed to have contracted the virus within Nigeria, as signs and symptoms of the disease were noticed on the 10th of April, after surpassing 14-day incubation period. Joining me now virtually to give us an update on the current situation is the Cross River State Commissioner for Health, Dr. Henry Ayuk. Thank you so much, Doctor, for joining us.
Thank you very much. Good afternoon.
So, quickly, let's dive into it. What is the update, particularly with the patient and all of the people that have been traced to the man?
Yeah, thank you so much. We have a very encouraging update. We have only one case. That case has received a lot of treatment at our isolation center. He has recovered. And I'm sure by today it should be discharged. We had listed 14 others who had had close contact with him. And those 14 have been tested, and all of them are negative. So we have retested the index case, and he's also negative now. So as a matter of fact, in terms of diagnosis, laboratory diagnosis, we don't have an active case right now. But that is not to say that we are folding our hands. The Cross River State government is very, very prepared. We have a very strong surveillance team that is already working. We're still monitoring for more disease, for more symptoms. Our facilities, particularly primary health care facilities, have been activated in that local government area to monitor and search actively for symptoms. We are, as of today, we have not closed down on the intervention. The intervention we have started will continue. We're monitoring for more active cases in case they appear. We will continue to expand our scope to other local government areas. So that is where we are.
Okay, that's good news. Let's talk about your collaboration with the Nigeria Center for Disease Control and Prevention. What role did they play in this?
They are a very significant body. They are the umpire, they are the coordinator, they are the ones that confirm whether you have a disease, a case, so to say. If you have a case, and not only for COVID-19, Mpox, and other cases, Lassa fever, and other forms of diseases that come up from time to time, they are the ones to seal and say, yes, this case has been confirmed or not. The diagnosis that are carried out are moderated by them. They're the ones that confirm, and they direct the policy. They give us directives. The guidelines are from there. So whatever we are, implementing, even this current, as regards this current episode, the guidance is from them. So it is a very important and key coordinating body.
Mm. And so I'm sure you heard about how the news or the story that there were 10 more people diagnosed, but you've reconfirmed again that it is just a case and the case is improved greatly.
The case are not, yes, for the index case, there's improvement, but for the cases, for the contacts that have been highlighted by the media house, that information is not correct. We don't have 14 cases. We don't have 10 cases. We have contacts. Probably he mistook. And I've kept on saying, for the purpose of understanding, being aware of the terminologies we use in epidemiology, let me emphasize again, when we say contact, we're not saying that a person is a patient. We are actually saying that he has contact with somebody that has the disease. He has had significant engagement with the person. So when we are investigating people who are likely to have the disease also, the infection, we would bring on board the contacts to investigate, monitor them, and see whether they will have the symptom. But that does not translate until they are diagnosed in the lab. That does not translate to the fact that they have become cases. Then the second thing that people sometimes get confused is when we say people who have symptoms that mimic. Those are just suspects. Just like you have a suspect in crime, you carry him to the police station, he is not sentenced. He has to undergo questions and investigations. So the same thing when we say suspect, we're saying that people might have symptoms that mimic COVID-19, but that is not to say that they have become COVID-19 victims. The third one is the case. The case is somebody with full-blown disease and has been confirmed in the laboratory that he is a case, is actually positive. That is when you can say that case, that person has become a case. So these three terminologies are different. So I just decided to highlight that so that the media houses that are helping us to cascade this information would be able to assist us cascade it more appropriately.
Thank you so much indeed for that update. I've been speaking with the Cross River State Commissioner for Health, Dr. Henry Ayuk. And there's more to come. Stay with us. To share a broader view of what's being done by the Nigeria Center for Disease Control and Prevention to contain possible widespread transmission of COVID-19 in the country is the incident manager of the National COVID-19 Technical Working Group, who is also the head of Evidence Generation Unit, Department of Planning, Research and Statistics at the NCDC, Dr. Mohammed Usman. He joins us from our Abuja studios. Thank you so much indeed for joining us.
Thank you for having me.
And it's been 6 years after the world heard about COVID-19, and is the NCDC surprised at the resurgence of this disease?
Thank you very much once again for having me. NCDC is not surprised at all, and I don't know if it's appropriate to say resurgence of the disease. You've heard from the Honorable Commissioner of Cross River State just now. I think we need to be careful with the terminologies we use in epidemiology, because when you say resurgence, it's as if it has never been there and all of a sudden it's coming in waves, and which is not the case. We have had about 7 cases in 2026. We had 28 in 2025. So COVID-19 never left, and we have not had resurgence. When we say resurgence is when you have a wave of multiple cases within the country, and that is not the case. That of Cross River is an isolated case, and you have seen, right, you've heard and from the Honorable Commissioner of Health of Cross River State, even the contacts have been confirmed negative by our National Reference Laboratory in Abuja here. So it's not a resurgence, just to correct the terminology, is a case that has been detected in River State, which is not unexpected because COVID-19 never left Nigeria, never left anywhere in the world. COVID-19 is endemic. in Nigeria as well as the whole world. It never left. So we can have pockets of cases here and there, and we manage them in the proper way, and then we discharge them as part of the routine, management of cases. So it's actually not a resurgence, but a case in Rivers State.
And it's nothing, would you say it's nothing to worry about, right?
Yes, it is nothing to worry about. Like I said, it's not the first case this year. We have other 7 cases. So this makes it the 8th one in 2026. That is nothing to worry about. The media has not heard of those because they have been managed routinely by our healthcare system. They have been detected by our surveillance network and managed by our healthcare professionals. So it's actually nothing to worry about. But that does not mean we should not be alert. We should not practice the hygiene best practices, we should not wear face masks where necessary when you have symptoms or when you have cold and so on. That does not mean we should not do that, but there's no need for panicking at this point because everything is under control. That's what I'm saying.
Okay, so for some Nigerians who may have forgotten what COVID-19 is about, please remind them of what it is, how it's contracted, the signs and symptoms.
Yeah, so COVID-19 is a viral disease, it's a respiratory disease, just like we have other respiratory infections like influenza and so on. It's contracted mostly via droplets and close contacts. It's airborne, of course, so you can contract it via close contact of sneezing or contaminated surfaces when you touch it and then you rub on your face and, you contract the virus. So it's a viral infection, and we've had that our first or index case, the actual index case, in 2020, back in 2020. That was when we had our first wave, and then we had another wave early 2021, when we had another wave again towards later in 2021, and then we had our 4th wave and the last wave so far in 2022. Symptoms are mild, so they're between mild to moderate and severe. Mild to moderate are fever, coughing, cold, sneezing, and so on. And then in some cases you have diarrhea and so on, edema. And then in severe cases you have breathlessness. And these symptoms have not changed over time. As I don't know if you're aware, the virus mutates. It has mutated over 100 times between 2020 till date. We have had so many variants. I'm sure you've heard of the Delta variant that was famous in Nigeria. And then subsequently we had the Omicron variant, which has mutated various times into multiple subvariants. And what we have seen so far, we have not seen a significant shift in symptoms of this variant. So it's very much the same, I would say, the symptoms of this virus.
Okay, now let's speak to the strength of Nigeria's disease surveillance system.
Yeah. So our surveillance system never stopped working, even when we de-escalated and subsequently deactivated our response activities. The surveillance system continued, and that is why you're seeing me, I'm still here. We have a COVID-19 technical working group, which we are tasked with monitoring locally and also global trend of COVID-19 in Nigeria and outside Nigeria. And part of the pillars we have is a surveillance system, which we have across the country. And we detect these cases, and then we are notified through this surveillance system. We have a summer system, which is our surveillance platform, where we, report cases from the community level down to local, the LGA level and the state level, and as well as the national level. That has never stopped working. It is why, in fact, it's one of the reasons why this Cross River case was detected easily and quickly because the surveillance system still works. We have cases and we detect them. We also collect the samples for positive cases and send them to our National Reference Laboratory in Abuja here for advanced genomic sequencing. And that is how we, identify the strains. It might interest you to know that we have gone beyond the routine surveillance now. We are now at the advanced level of genomic surveillance, where we go beyond identifying the positive cases, but identifying the strains responsible for those symptoms. And we have so far identified the various strains that are circulating in Nigeria. But the good news is they have not resulted in any significant change we have not seen any sporadic cases coming up or severe symptoms, except for the one isolated one in Cross River now.
Okay, so what more then should state governments, through their state ministries of health, be doing right now in terms of disease surveillance and reporting systems?
We work closely with the states. Our surveillance system does not work in idle, does not work alone. Like I said earlier, it starts from the community down to the LGA level, and then the state, and then before it gets to the national. So states are very much important in what we do, and CDC. Our advice has been and will always be is for the states to continue to support the surveillance activities. We know there are conflicting priorities in some states where they have challenges of other public health diseases, like Lassa and so on. But we cannot, let our guard down because COVID is very much alive. It's never left. So surveillance testing for symptomatic cases is very important, and reporting appropriately, as well as sending the positive samples to NRL for genomic sequencing. Over time, in collaboration with the states, we have tried to routinize our testing because of, the low demand in testing and the low enthusiasm in testing. You wouldn't want, someone that is apparently healthy wouldn't just want to be tested for COVID-19. So one of the strategies we came up with is to test at the healthcare facility level, where people go to seek help, and you use that opportunity to see if you come with respiratory discomfort. If it's among our sentinel sites, your sample is collected and tested at our reference laboratory, and subsequently, if it's positive, we sequence, identify the strain responsible for that. We advise states to support that. We currently operate sentinel sites, meaning it's not everywhere. We have in selected facilities. It would be good to expand that to cover more facilities. That is where states can come in. Especially there's the state facilities, the secondary healthcare facilities in the states. If we can have that to expand our testing network, our surveillance network, that would give us more information, and we'll be more confident to say this is what we have in Nigeria.
All right. As we wind down on this discussion now, what would you recommend for health workers and in hospital settings concerning vigilance, combined with strict adherence to established infection prevention and control?
Absolutely, very important. Our healthcare workers should always remember that infection prevention and control is key, especially at the healthcare setting. Our index of suspicion should always be high. Respiratory discomfort should not be treated as irregular flus until verified or confirmed they're flus. So at the point of triage, PPE should always be used for managing and then attending to cases at the point of triage, because someone can come with respiratory discomfort. You cannot know whether it's normal flu or it's an infectious disease until you test. So that point of entry, the triage centers should always be their PPEs. Healthcare workers should always be on PPEs and, raise their index of suspicion to identify suspected cases and test them appropriately. And of course, for, the public, I would also say, the cough etiquette should continue to be practiced, and hand hygiene. And for people with symptoms, flu, even if it's normal flu, as long as you're sneezing or coughing, preferably use a face mask if you can. If you don't have, if you're sneezing or coughing, you cough to your arms. Yeah. And then, of course, when you have symptoms, you go for a test and isolate yourself as much as possible. Don't, go into crowded places or go into people.
Yeah. Thank you indeed, Dr. Mohammed Usman is Incident Manager of the National COVID-19 Technical Working Group and also the Head of Evidence Generation Unit, Department of Planning, Research and Statistics at the NCDC for your time on the program. Thank you indeed.
You're most welcome. Thank you for having me, Ami.
And just before we go, here are the latest stories on our news segment.
The issue of quackery in the medical profession, especially as it concerns nursing, is the reason for this visit to the force headquarters by the National Association of Nigeria Nurses and Midwives. The association is seeking the support of the Nigeria Police to address the increasing cases of charlatanism in the profession across the country. While on a working visit to the Inspector General of Police, Mr. Olatunji Disu, the president of the association, Mr. Haruna Maman, says the activities of quacks in the profession are becoming worrisome.
We wish to draw your attention to a pressing issue affecting the healthcare sector. This is proliferation of quacks and unqualified individuals posing as healthcare practitioners. The activities of these quacks not only endanger the lives of innocent Nigerians, but also undermine the integrity of genuine healthcare practitioners. We believe that with your support and collaboration, we can combat these menace effectively. We kindly request your assistance in the following areas. We request your good office to instruct the Commissioner of Police in each of the 36 states, including the Capital Territory, to join hands with our state councils in fighting this menace.
I've been trying my best to ensure that we do it as police officers. Now that I'm even the Inspector General of Police and my officers are listening, we take it more seriously. Talking about auxiliary nurses, auxiliary this and that. I know it has been the problem, but yes, there's nothing like auxiliary nurses. There's nothing like it. And they are practicing quackery.
Exactly.
What you do, everywhere you have hospitals, please try as much as possible to meet with the DPO. Every new DPO that comes is very, very important. So commissioners of all the states will be informed of this visit and will be ever ready to assist doctors and nurses having any problem at all.
The Taraba State government, in collaboration with the World Bank, Nigeria Governors Forum, and other partners working in the health sector, have come together to address the causes of high maternal and neonatal deaths in the state. At the meeting in Jalingo, the state's capital, stakeholders advocate for the strengthening of routine immunization and primary healthcare service delivery in the state.
It is of interest to know that Nigeria, being one of the countries with the highest maternal mortality in the world, as we speak, Northeast, we have maternal mortality of over 1,500 per 100,000 live birth. What it means, if you have 100,000 women that are pregnant, you have over 1,500 of those women will die. Pregnancy is not a death sentence. It's supposed to be a blessing. And here we have people dying. And what do we do to address this maternal mortality? What do we do to get vaccines to our children? What do we do to ensure that we give the best? It is this MOU, and the capacity of our staff have been built.
The Governors Forum will continue to back Taraba and other states to strengthen primary health care and ensure no child is left behind. Let's keep working together to build a healthy, happy, and protected community.
To boost the fight against vaccine-preventable diseases, wives of local governments chairmen were inaugurated as ambassadors to serve as grassroots champions for routine immunization, mobilize mothers and caregivers within communities, and dispel misconception surrounding immunization. Finally, as the world marks Malaria Day 2026, the World Health Organization reiterates its commitment to working with malaria-endemic countries to end malaria. The WHO and partners launched the theme, Driven to End Malaria, Now We Can, Now We Must, to serve as a rallying cry to accelerate progress, protect lives, and fund a malaria-free future. The theme highlights that while the tools to end malaria exist, vaccines and new treatments, urgent action is required to combat rising threats and funding gaps. The WHO is also promoting new tools, including next-generation insecticide-treated nets, long-acting injectables, and genetic modification of mosquitoes.
Remember, COVID-19 has not fully been eradicated globally, with different strains developing. The Niger Center for Disease Control and Prevention is encouraging everyone to remain calm but vigilant and adhere to public health guidelines. Thank you for watching. I look forward to seeing you again next week. I'm Yomi Otaigbe. Bye for now.